Well, hello. Thank you so much for joining this Facebook Live Coronavirus Chat. I'm BJ Murphy, publisher of Neuse.com, and we have a very, very special program for you today. A lot of news happened in the last 24 hours, and we've got a couple of really great guests. If you are just joining us, please make sure you go ahead and share this broadcast, because I know just based on some of the questions and some of the things that we've already talked about with our guests off air, there's going to be a lot of good topics that people will want to know and really would benefit our community if you would just share this with them or tag a friend in there just so that they know that this has actually happened. So thank you so much for joining. I really appreciate it. And we're trying a couple other new things today, so we'll see if that works out, just so we can continue to expand how this works for our community. But really big news today. Governor Cooper today, he said, and I quote, "Further action to protect our state will be necessary. We will be issuing additional orders soon." He didn't go into specifics on what those orders will be, but there's a lot of speculation. I think a lot of us know that this is something that's been coming, and so we're certainly expecting to. We're keeping an eye on right here at Neuse, certainly expecting more orders coming from the governor in the next 24, 48 hours. But look, if you're signed up for our breaking news text alert, then you got that message first before we put it out on any social media platform. All you really got to do is just text the keyword NN to 484848 to receive our text message breaking news alert. Again, that's NN to 484848. We had a lot of people in the last 48 hours sign up for this since we kicked it off, and I was so shocked about how many that I was like, man, this is a really good thing. So I'm glad we've invested in that. Some sad news across the state of North Carolina today. There was our state reported its first death. There was someone in Cabarrus County, a Cabarrus County resident, passed away due to COVID-19. And the governor mentioned today that there's probably going to be more. But it says really unfortunate, but that is the reality. And that's part of the reason why we're having this live broadcast, to help you better protect your family and your business and yourself. As of 10:35 this morning, the North Carolina Department of Health and Human Services reported 504 cases across the state of North Carolina, including yesterday, Lenoir County Health Department said that there was a confirmed case in Lenoir County. I spoke to the Emergency Preparedness Coordinator in Jones this morning, still zero in Green as well. But we certainly expect that number to rise, unfortunately, and we're going to continue to do everything we can to make sure that you know what you need to do to protect your family. Look, if you like what we're doing and you want to chip in to help Neuse, we're coming out with some really cool T-shirts. We've already ordered them. They'll be here in the next week or two, and just go to Neuse.com/T-shirt. And we didn't even put a price on them. If you want to give $5 or $50, it doesn't matter. We just want to send you a T-shirt as a thank you for all your support and how you've helped us at Neuse. And also, lastly, before I bring on our first guest, that we've got a very, very active We Report Neuse Facebook group, because there's so much information that's happening so rapidly. I remember literally in my office chair this afternoon, just kind of sinking in the chair going, I just can't consume but so much information this quickly. But look, if you're in a spot and you're a neighbor, you want to help somebody, or you got a question and you could use some help, we started We Report Neuse Facebook group just for those reasons, because there's only so much information we can share and help with each other. Maybe there's some things that your neighbor can to share with you. So please join our We Report Neuse Facebook group. And as always, everything we do here at Neuse is free. So thank you so much for that. The UNC Lenoir Healthcare issued some new visitor guidance this past week, and I'm really happy to have the Chief Medical Officer for UNC Lenoir, Dr. Claire Parrish. Thank you so much for joining us today.
Well, thank you for having me.
Well, I know that you've been very busy, because you and I have had a chance to chat a couple times over the past week. A lot of changes happening. But let's talk real quick about some of these visitation policy changes that UNC Lenoir had to amend and put in place this week.
Well, it's been a process to slowly ramp up to where we are with the visitation policies. We started off with, honor system type visitation policy, and that was successful in decreasing some of our traffic. Of course, this COVID virus is spread by close contact. It's spread in places where people come together. So anywhere that you have groups congregating is an issue, and can spread this virus. So having less contact here is a good thing. We want to keep our staff safe, keep our visitors safe, keep our patients safe. So if we can keep out as much traffic that's not needed here, that's our goal. So we have gone to checking people at the door. We have, as you walk in our front entrance, we will ask you who you're here to visit. Each patient is allowed one visitor, and that's not one visitor at a time. If there's 10 family members, you can't take turns. It is designating one visitor for you for the hospital stay, and that minimizes the risk of exposure or bringing something into the hospital that was not here before. We do have recommendations on ages. You have to be 18 or over to be able to visit. And we strongly encourage you, if you're in a high-risk group, such as over 65, or you have a lot of health issues which could predispose you to becoming very ill if you get this virus, we've asked you to stay home. So if people can maybe use FaceTime or use the phone and pick up and call their loved one or call their neighbor that's in the hospital instead of coming in to visit, that would be very helpful. But we do have smiling faces at the door who will ask you who you're here to see, and the nurses also will make sure that you are the one designated person for that patient.
Well, thank you so much for that. And real quick, Dr. Paris, we have actually breaking news since we've gone on air. The Lenoir County Health Department has just issued a confirmation of a second COVID-19 case in Lenoir County. The Lenoir County Health Department received notification of the lab confirmed case on Wednesday, March 25th. And similar to what occurred with the first lab confirmed case on the 24th, the resident also traveled out of the area, and this is not a result of community spread. The individual is recovering at home. To protect individual privacy, no further information will be shared. And there's a quote from Pamela Brown, the director of the Lenoir County Health Department. Our sincere thanks to the medical community that continues to test people as needed, for members of the public who continue to practice social distancing and staying home as much as possible. These measures will help protect our community. And then there's a information about CDC. So breaking news right here live. It's the first time I think that's happened to us. But you know, when it comes to the hospital, Dr. Paris, you know, I know you've had some patients and you've done some testing. Can you share with us how much testing has actually happened at the hospital and what those results have been so far?
We have tested 7 patients, and so far 4 of them have come back negative, and we are still awaiting results on 3. You have to also understand that we don't do testing in-house. We have to send this out to LabCorp, to a bigger lab, and they have been inundated. So it takes over a week to get results back. They tell us a few days, but we're finding that it's about 7 or 8 days at least.
And when it comes to the staff, I know there's certainly concern about you know, the number of. Let's talk about the number of available beds, and then we'll get to the staff. I mean, when it comes to the capacity of the hospital, we haven't even begun to see what other communities and other countries have seen, and hopefully we won't. But worst case scenario, what is the capacity of our hospital? And then let's talk about staff.
Well, we have been looking at the capacity of our hospital and trying to figure out how we can take care of this many people efficiently and safely when we're not used to having these type numbers that we are predicted to see, but hopefully we won't. So it's sort of like preparing for a hurricane. You want to board up the windows and get ready, and you hope it doesn't come. That's the closest analogy for Eastern North Carolina that I can come up with. So we just hope it doesn't come, but we can flex up. We are seeing lower volumes right now. I think people with milder complaints are staying away from the hospital. We have reduced our elective surgeries. So if people can put
Mhm.
off having something done, we are doing that. So that is creating more available
And I
beds
and I
here.
and I can attest to that because my oldest daughter is supposed to have a tonsillectomy, and the pre-op appointment was scheduled for tomorrow. So we actually took a phone call today instead of doing a pre-op appointment. They actually did a lot of the questions over the phone. The surgery is still scheduled; it's on the books, but we know that that's most likely going to get pushed off, and it's okay for us. It's not an emergency surgery; it is an elective. It's in her best interest, but it still is an elective surgery.
Yeah, and we certainly understand that it is an inconvenience for a lot of people, but we do want to save our resources and save our staff for those that are more urgent. So if you come into the hospital with an appendicitis or something, we would be glad to take care of those cases. We are open for emergencies, but things that can wait, we're asking people to wait. There are shortages of masks, there are shortages of gowns. So we're also dealing with that and looking every day at our resources and how to make the best use of them to keep our staff and our patients safe. So if we can put off using some of these things for a few weeks, that's best. And to keep our staff available, we are looking at repurposing staff. If you are working in an area that's, for example, outpatient surgery, perhaps some of those nurses could be best used somewhere else if we became very busy with this coronavirus. So
Yeah,
we
I
have
would
mapped out
imagine
all
that
of our resources.
yeah, I would imagine that the health and well-being of your nursing staff and your doctor staff and the support staff is really important to our ability here locally to attack and protect our patients and their families.
We have a wonderful staff, and essentially, they are on the front lines of this battle. So we have to keep them safe because if we don't, they cannot continue their mission. They're here, they want to help people that are in need, help people that are ill. And if they become ill, they cannot do that. So we have to really protect our staff so that we can protect our patients.
And speaking of protecting staff, let's talk a little bit about your need. I've seen this across the state and even a call across the nation. And in fact, even in your press release from UNC Lenore the other day, it mentions the need for medical supplies. For example, N95 masks, surgical masks, nasal swabs, eye protection, face shields, disposable gloves, and disinfectant. Can you give us an update on the supplies at the hospital and if you still need some help with that?
Yes, I'd be glad to talk about this. This is something we get reports on every day. We are happy to say that we have um, really taken steps to shore up our usage of this. We actually had some instances of people walking in the front door and where we have the displays with the hand sanitizer and the masks. If you have flu symptoms, put them on. People would just take the box and leave the hospital. So we've really had to be very judicious with that and help and give out masks when they need to be, but make sure that they are not leaving our facility for other uses because we do need them for our patients. So every day we look at all the different varieties of masks we use. We use some that are more of a respirator, called an N95 mask.
Hmm.
And we need to reserve that for people working directly with any COVID patient who might be creating an aerosol. For example, if they are taking a nasal swab from that patient or putting them on a ventilator, those are the type high risk activities that really require a respirator. Just talking to a patient, you can use a surgical mask. So both of these items are on short supply nationally. And for several reasons. One, everyone's trying to order them because of this virus. And also many of them were made in China, so the production has been slowed. So it really is a problem nationally. We have had some companies donate masks, and we have put out the call to say if you are in a business such as a dentist's office or another medical office or a tattoo parlor that normally uses masks and you're closed right now, can you spare some of your masks? Would you like to help us? And we have actually had people step up to the plate and do what's right for the community and
That's good
help
to hear.
out. And we just
Yeah, that's really
got a
good to hear.
shipment in today. So we were happy to hear masks were donated.
And a couple of questions, if you don't mind, on our Facebook feed as we start to wrap this up, and I'm going to bring on Dr. Pradeep here in just a minute. Do you know how many respirators there are at UNC Lenore at this time?
We have about 30 ventilators actually on hand. So we have been, and we have some that are more updated than others that we can use those in various areas of the hospital. And we also have some machines that normally are used for a non-invasive ventilation that can be adapted to invasive ventilation. So we are fairly well equipped with ventilators up to about 30, including our anesthesia machines.
All right. And the other question that I saw was about the number of test kits. Does UNC Lenore have access to test kits? Do you have enough on hand for the short term? What is the status on that?
So we do not have any in-house testing at this time. It has been ordered, but as you can imagine, every hospital has ordered this as well. So we use Cepheid, and that is our company who can provide this, and they have 23,000 customers worldwide. So everyone's trying to order, and we have put in the order for about 300 test kits. We don't know how many we will get, and that may be a few weeks off. Right now, we are sending out specimens to LabCorp, and we have enough of the swabs to send because we can use some of our flu kits to actually send those off, but it's very delayed and they're on allocation as well. So it's important to realize that not all people with this need to be tested. If you are not having any other complications, you don't need to be tested. If you suspect you have this, you need to stay home. That is the most important thing. We need to reserve our testing for those that might need it more, that we critically need to know if those people actually have it.
And one final question for you, Dr. Parrish, before we jump off. And this came from Lenore County Commissioner Jay McDaughty. And he said, ask Dr. Parrish to describe the hard balancing act they're having now with acute patients, flu patients, and then having then the incoming potential COVID patients.
Wow, that's a really great question. There's a lot of things to balance. Everyone is on edge about this, and so it's all we're thinking about. And when we get regular flu patients in, we have to realize this might just be the flu. This might just be pneumonia. How would we have treated this patient 2 months ago? And that's important to realize and really go through our criteria for testing and our criteria for suspecting this. The CDC has put out great criteria for this, and that's what we're following. So there is a big balance, and we want to keep those patients safe because those patients that come in are at very high risk for getting COVID-19. So not coming into the hospital if you don't need to be here and you suspect you have it keeps our most ill population safer. So that's important to know. We're trying to identify people right at the door before they get in, before they sit in the waiting room, so that our most fragile population of sick patients is protected.
Well, look, Dr. Parrish, we really appreciate you and your entire team at UNC Lenore Healthcare. Thank you so much for jumping on today. And look, we look forward to staying in touch with you. And if you're watching this, please throw Dr. Parrish a few hearts just to say thank you. Have a great day, and thank you so much for joining us, Dr. Parrish. Stay with us. We've got another guest coming up. Thank you, Dr. Parrish.
Thank you. My pleasure.
And we are really happy and honored to have back with us Dr. Pradeep, who is no stranger here to this broadcast. Has actually been on this broadcast a couple times already, and we've had a lot of questions from Dr. Pradeep over time. Dr. Pradeep, how are you doing today, sir?
Doing good. How are you?
Fantastic. Travis, did you bring him up there? I can hear him. I just can't see him just yet. Oh, there you are. Good. There you are. I knew you had that clean shaven face, and he got on me. He said, BJ, you didn't shave yet. I said, no, I still need to, but I haven't. I'm holding out as long as I can, Doc.
I mean, in all honesty, you don't need to, but it would be a good thing to do, on TV.
Well, look, we've got a few more questions here that wasn't able to get to with Dr. Parrish, so I'll ask some of those. But first, can you give us an update from what you've seen? We just announced breaking news or just a while ago that Lenoir County Health Department has announced the second case here in Lenoir County. No real shocker there, but something that we expect probably to see more of before it kind of settles off. What are some of your latest insights you've seen today?
The first thing I wanted to tell you is just because you are tested positive really doesn't change anything for you. Okay. The only difference it would make is you would be more careful, you would all of those kind of things. So it's not the testing. If you have mild symptoms and you have the coronavirus, it really doesn't matter. As far as you are concerned, as an individual, it does not matter. What matters is, will you be spreading it to other people? So if you have the symptoms, then you don't need to be tested if it is mild. Ideally, we should test everybody, but we do not have enough tests. So what you need to be doing is, if you have the symptoms, you stay at home, you self-quarantine, okay? And that is what I would suggest doing. Now, there are two deaths in hopefully will. We need to be prepared for it. Okay. Now, the other issue was, if you look at the numbers from yesterday and today, we had 8,000.
Dr. Pradeep, you broke up just a tad bit there. Looks like your internet's having just a little bit of a
13,000
challenge.
tests,
and
62,000
there
cases,
you are.
which is around the what you would predict. And it's going
Dr.
to
Pradeep, can you go back and repeat that number for me real
3 days
quick?
to 4 days. So in around 3 to 4 days, you're going to expect to see around 130,000 cases. And that is a whole lot of cases. Now, the good thing is a lot of people out there have come up with ideas, and they're all working together. For example, Claire was talking about the ventilators. They have 30 ventilators in Lenoir. Will that be enough? We hope it is enough. But if it is not, there have been other cases where they can use the ventilator for more than one person, like make it into for 2 people, make it into for 4 people. These are all extreme scenarios, but that is something we are looking into right now. We want to be prepared. We want to have things in place for it in case we need it. We hope we never have to use it. For example, there are 2 college students here, Scott Matthews and his girlfriend Rachel. They came up with this 3D printed adapter for the ventilator to use it for 4 people.
I've actually seen that.
So
I've actually seen an image
can be
of
used
that.
to 4. So if you have 30 ventilators, you can potentially hook 120 people. Okay, we hope never to have to use it, but in case we need to, it is there. Okay, so there are innovative ways to do that. That has been out there that people are doing right now. Okay, so one other thing I wanted to mention, I was looking through Facebook. There are still churches out there asking people to come to service, which I think is a little irresponsible. I was looking at this church in Hookerton. That is, this is what they have put up. In place of our Thursday night Bible study, we are going to seek the Lord. We understand those who are being precautionary by shutting in, but to those who can trust God enough to answer this clarion call, be there. What do you think all those people are going to do? They're all going to come into church. I don't think that is right, but I don't know what to do about it.
Mm-hmm. No, there is a sense of social responsibility that has to happen here. And I think that's a big part of your point just there. Can you hear me, Dr. Pradeep? I can't tell if he can hear me or not. It doesn't look like he can hear me, but we can hear him. Travis, is there a way to message him and let him know that we actually can hear him? Let me see if I can do that real quick, just to make sure. Hey, this is what happens when you're live. We can hear you, but
I don't see you guys,
hear
but
me.
I guess you can hear me. I can't hear you.
Yeah. I'm going to tell him, just keep going.
Okay. So
Yeah, that
the
dingy
next
hears
thing we
me.
wanted to talk about is treatment options. Now, when we talk about treatment options, one of the first drugs that came out of China, I can't even pronounce this. It is a drug it's an HIV drug that they tried, and it failed miserably. So then there is another drug made by Gilead Sciences called remdesivir. I don't know if that's how it's pronounced. There are multiple studies out there that are going on right now, sponsored by the NIH and Gilead, to see if it will help prevent this virus from or cure people who are sick with the illness. Okay, the other drug that has become pretty famous, we all knew this drug. We used to take it for malaria before, but now it has become pretty famous: hydroxychloroquine and chloroquine. I do have a problem with with making it famous, and especially if you look at it in Arizona, somebody took the aquarium cleaner, which is kind of pretty dumb to do. Why would you take an aquarium cleaner when your physician has not prescribed this for you? Now, what the study that was done that made this popular was done in France. They had 26 patients, okay, just 26 patients. And out of 26 patients, a bunch of them still died. The study did not show that it improved your mortality, it did not show that you got better. All it showed was when you looked at the respiratory secretions, the virus count was lower. That is all it showed. And just this one study made this drug very popular, which at this time, I'm not saying you should not take the drug. If I'm deathly ill with the coronavirus, yes, throw the kitchen sink at me. I don't care. But this does not mean you should use it for prevention and things like that, because it has not been studied enough. There are multiple studies out there going on. If I get sick, if I get the coronavirus, and if I get sick, what I would do, and what I would hope my family would do for me, would be to sign me up for one of these clinical trials, because in case I die, I want to be sure that the information is useful. Now, so BJ, you're asking me a question. How would you differentiate it between allergies? It is going to be hard. Okay, it's going to be hard. There's no way you can really say this is allergies. If you have a fever, the chances are that it is a viral infection. Now, could it be the flu? It could still be the flu. Okay, if you have fever, headache, body aches, all of that will go along with the viral infection. If you're really short of breath, it is the viral infection. Okay. Now, could this be COVID-19? Could it be another coronavirus strain? Could it be the flu? Could it be something else? Absolutely. But the simple allergy is going to be, you can have a runny nose, you can have puffy eyes, all of those things. But in general, if you have the flu, if you have a coronavirus and stuff, you should have fever. Now, how high of a fever, that depends on who you are. I mean, if you're older, supposedly you may not get that much of a fever. Any other questions?
Yeah, let's see if I can send this to you real quick, Dr. Pradeep. There's one for you. You hear that ding? That was me. I love technology.
The next question was, if someone has tested positive and quarantined for 14 days and is now symptom-free, can they be reinfected? At this time, we do not know. There are some case reports of people getting reinfected, but at this time, we do not know if they can get reinfected or not. Now, remember, the flu has multiple variants that come through every year. You can get the flu this year and still get the flu the next year. You can get the flu shot and still get the flu next year. So the same thing will possibly happen for the coronavirus. The main problem with this coronavirus is it does mutate pretty often. So my suspicion is, yes, you could possibly get it again. Hopefully not in this season. Hopefully there will be a little bit of lag time before you get it again.
And you mentioned the trials a while ago. Can you tell us a little bit about that?
The next question was, are we doing these trials here or can we? I'm not sure about that. I'll have to speak with Dr. Paris. I suspect it's probably there in the bigger centers and not really in the smaller centers. The trials are pretty simple. I mean, there is really nothing much to do about it, but you would have to get the placebo and all of that. So I will have to look into that, because it would be a good thing to have, though. But they're recruiting only 400 patients, so that trial should be over pretty soon.
Mm-hmm. And there was a question about N95 mask. Should they continue to be used or not?
So N95 rated masks, how long should they be continued to be used? Good question, because you will know in a few days, because we are reusing those N95 masks. I really don't know the exact answer to it, but like everything else, if you reuse it more than once, you are going to reduce integrity. It was never meant to be used more than once, but we are going to be using it because we are running out. We are running out of it. And we're hoping, we can get more of these soon.
And there was a question about the flu.
So the next question was, is the new virus we will see in our futures just like the flu? I suspect we're going to have the flu season and then we're going to have the coronavirus season. So until we get the vaccine, until we build enough herd immunity, this is going to be a problem. And that is the important thing about social distancing. I want to bring that up again. Social distancing is what's going to give people, the healthcare workers, enough time to design a virus or a treatment for it. All these trials that are out there run by private enterprise, the NIH, all the other governments out there, if you look at it, there are 93 interventional trials out there for this virus. So there is going to be a treatment somewhere. There's going to be a vaccine somewhere. You just have to give it time. They're predicting at least 12 to 18 months. So it's a long time, but it will be there.
And there was a question about 3D printing a while ago.
Can we 3D print face shields? I'm pretty sure you can 3D print face shields, but I have seen people 3D print masks. So, but I don't know about face shields as such, but I'm pretty sure you can. And there are people in Louisiana, in New Orleans, they're actually trying to 3D print a ventilator. That would be amazing, if you could 3D print a ventilator. So this guy I've been talking to in New Orleans, he is actually in the forefront of this, trying to 3D print a ventilator, and his open source. So the minute he figures it out, he's going to send it out to everybody. So that would make a big difference.
Let's see. And how about this one?
The next question was, I had heard that the drug is used for malaria can cause eyesight problems if it is used for long periods of time. Is that true? I have to look into it to let you know what if that is a problem or not. But from my medical school education, which was 25 years ago, more than 25, I hate to say that, but anyway, I don't remember it, but I'll look into it. But one thing I remember about chloroquine and hydroxychloroquine is it does prolong your, what we call prolonged QT. That is on your EKG, it prolongs your EKG, which can lead to really malignant arrhythmias like cardiac arrest and stuff like that. So that is why I want to be very cautious when people say they're going to take this drug when I'm near death, just give it to me. No, you need to be careful because these drugs have side effects. The risks should be lower than the benefits. If the risks are higher than the benefits, you shouldn't be taking this drug. And if you think about it, if 300,000 people get infected and you put all of them on this drug, you are going to have people die of cardiac arrest because of the drug. So the drug has to be worth it. Now, then the next question was my thoughts on treating with plasma from recovered patients. There are some small scale studies that have shown a benefit. We have used it for other treatments too. So in other viral infections too. So it should work, but it is going to be very limited. it should be, and it should be limited. It should be limited to the really sick patients that you think are going to die without any treatment. So right at this time, nobody knows. That's the honest answer. Nobody knows. We are pretty much throwing the kitchen sink at it. So how do we know who the people that test positive were in contact with? That's a hard one. You're still relying on what people tell you. You're relying on where they have been. It is self-reporting, sadly. So it is going to be very inaccurate. At this time, I'm still going back to social distancing. You have to, if you can avoid social contact, please do. That is really important. Yes, the economy is going to be terrible, but remember, if a lot of people die, the economy is going to be still terrible. At the end of the day, we will all come back. The economy is going to come back. You just have to suck it up and hunker down for the time being. We are all in this together.
Well, thank you so much, Dr. Pradeep. I really appreciate you jumping on. And we had a little technical difficulty, and we worked straight through it. So thank you so much for your presence here this afternoon. And he still can't hear me, but that's okay. Hey, look, everybody has watched. Even with the live broadcast, we were still able to practice social distancing. Dr. Travis Town is back in his home office. Letha Thrower, VP of Operation, is I think still here, is helping with the social media feed. We've actually tried something new today. We went live using the TV on our Instagram as well as our Twitter feed, just to see if that was something that we could try as another tool to get this information out to you. So we thank everybody for jumping on that. Look, if you haven't already, please go ahead and share this broadcast with your friends as public or in a message, because I know just based on the questions and answers there that there was a lot of people who have these questions. And I suspect if you're willing to ask the question, then there's a lot of other people who are thinking it as well. So please share that. And just to kind of recap, Governor Cooper today said that further action to protect our state will be necessary. And I quote, "We will be issuing additional orders soon." You learned about that first on Neuse through our text alert. So if you'll just text the keyword NN to 484848, then you can be a part of our breaking news text alert system. Again, that's NN, the keyword NN to 484848. And also, certainly we saw the first death in North Carolina today. And while we were on air, you heard about the second case here in Lenoir County. I want to say a special thank you to Dr. Claire Parrish, the Chief Medical Officer for UNC Lenoir Healthcare, for being on, as well as Dr. Pradeep. In fact, Dr. Pradeep said that, look, tell them to ask some more questions, and we'll come back on the next time he comes back. He'll go ahead and so if you have some questions for Dr. Pradeep, he'll be back with us in the next few days. Like we did this week, we did Sunday and Wednesday. That worked out really well for Doctor and his schedule. It was great to have Dr. Parrish on today. So the last thing I want to mention is if you go to neuse.news/CV, just bookmark that. I think you saw it on the ticker below, neuse.news/CV. Any article or post we make about the coronavirus COVID-19 updates, we tag that category so you see that. So when you go to that one page, you get it all. But please join our text messaging system. Text the keyword NN to 484848. And look, we thank you so much for all that you're doing. Wash your hands.